Now let's switch gears now, and disappointment, distress and confusion greeted patients on the rollout of the Social Health Authority as it officially took place of the National Hospital Insurance Fund, NHIF. While illness waits for no alignment on government plans to reality, some of the unwell found themselves having to pay for their services in cash, unable to either understand the coverage options or how to access essential healthcare services. NTV's Zainab Ismail reports on some of the realities of the rollout of the government's mega health insurance project.
As the government officially rolled out the new health insurance scheme SHA, replacing the National Hospital Insurance Fund NHIF, Kenyans across the country continue to express uncertainty about the new system, citing a lack of enough information regarding the benefits and enrollment processes.
Mimi nakujaga hapa matibabu ya osteotherapy, kuna shida ya mgongo. Nilikuja hapa nikaona kuna launching ya SHA. Nikakuja hapa nikauliza, nikaambiwa niandikishe hiyo jina niwekwa kwa system ya SHA. Nishaiwekwa. Mzee wangu ako na disability ya mkono. Sasa naambiwaje? Ate yeye alipe yake kando na mimi yangu, na yeye hajiwezi. Sasa hiyo kadi itanisaidiaje?
Kama mmeamua tu kuachana na NHIF, mkuje kwa SHA, so mtusaidie. Mkuje hata kwa ground, mfunze watu waelewe vile anakata hiyo kadi, vile anapata hiyo huduma ya serikali.
Nimekuja hapo nikaambiwa ni kama SHA ifanye mpaka sijua rollout, na mimi nisha rollout kwa simu nishapata, lakini mimi sijui nalipo aje. Hatuelewi, hata machifu hajakuja kwetu kutuambia.
They did not have a new contract, so because they didn't, they called all their patients and they said, tomorrow when you are coming, you are paying cash because you don't have a contract with SHA. So my wife was one of them, and thousands of others across the country. Menishika, because all of them called their patients and they told them it's not going down. So, man, when we got that phone call, my wife completely devastated. Even if I can afford one or two, I can't afford dialysis for a whole month. It's expensive. It's 951. She does 2. 4 in a month is about 80,000 shillings. That is really expensive. No average Kenyan can afford that.
Karumba Ngatia, also known as DJ Kroba, took to social media to highlight the challenges he faced as a caregiver to his partner who has chronic kidney failure that blew into a national debate about patients with chronic diseases being turned away by facilities that have not signed an MOU with the Ministry of Health or forced to pay out of pocket.
I am favored enough that I can call people to find out about these things. Now imagine people who don't have that. They go to a facility, they don't know who to call. So I called, and the guy said, what's the name of the facility? That's the only thing he asked. Said, awesome, with the name of the facility, we can follow through. And in an hour, they followed through.
However, in a dispatch dated 30th of September, the Social Health Authority Acting Chief Executive Officer Elijah Wachira clarified that all contracted hospitals should continue to provide dialysis and cancer services to patients. The directive notes that no member will be denied dialysis and cancer services. Maternity services should not be denied in level 2 and 3 hospitals, and active managed schemes should continue accessing services. Critics, however, remain skeptical, arguing that the success of SHA will largely depend on the government's ability to effectively communicate its benefits and navigate the transition period. Zainab Ismail, NTV.